Okay, let's go.
Hi, guys. Welcome back to another podcast episode for Unmasked Health. I'm your host, Shelly. And I know it's been a minute since I've actually recorded a video. I had a guest co host that recorded the week before last. So we're still trying to figure out, this whole podcast thing. I'm new to it. So if you have any suggestions or ideas, please listen below. At any rate, today I want to focus, kind of get a step away from, testosterone and the effects on men's health, women's health, mainly men's health, and let's focus a little bit on mental health for men. I kind of felt led to discuss this more. I know I've done a prior episode on mental health and the effects that low testosterone can have on your mental health. But mental health in itself needs its own category, especially when it comes to our men. So I'm hoping that this is going to be a series of like 4 to 5 episodes, short episodes, short duration to kind of keep your attention, but to kind of get the point across and how important it is for us to address mental health in our men. So let's just start. Recently, there have been a few suicides around in the surrounding area for me in our men, ranging from 30 to 50, and no signs or no warnings is what um, I've been told. So it's not to place blame on anybody or anything like that. That's not my purpose in this show. My purpose in this show is to say mental health is important to men, and why are we overlooking it? What is happening in the mental health world for our males? So it's estimated, period, this is like men and women, estimated 1 in 5 adults in the United States suffers from a mental disorder like depression, anxiety. Um, Mental health in men is less likely to be treated, diagnosed, because men don't seek help. And we'll talk a little bit more about that in a minute. Men die by suicide at a 4 times rate higher than women. And it's become more prominent, especially since COVID. And I know everybody's so sick of hearing about COVID, but since the pandemic and everybody was shut in for a while, um, we are seeing higher suicide rates in our men. Men are 2 to 3 times more likely to abuse substance like drugs, alcohol, than women. And I consider that self-medication because, why is that happening? And I'm not saying that women don't self-medicate. Anybody that has an addiction is likely self-medicating for some reason, whatever that is. But we are seeing higher substance abuse and alcohol abuse in our men because they're self-medicating. Men don't know what to do with the emotions that they're feeling. They don't want to seek out help. Again, mental health is less likely to be diagnosed in our males because males do not go to the doctor. They don't seek help. In an earlier episode, maybe my first or second episode, we talked about the reasons why men do not seek medical help, and that is because there's this whole facade of a man is supposed to be stronger, no sign of weakness, whatever. You're also supposed to be the breadwinner of the home and the provider of the home, so you don't take time off from work to go and take care of yourself, to go to the doctor and spend an hour. So why are our men not asking for help? And the number one thing when I was doing my research over the past few days, the number one reason why is because of stigma. And there are different types of stigma. There's social stigma, there's cultural stigma, there's public, stigma, self-stigma, self-inflicted stigma, that kind of thing, those sorts of things. But mainly stigma because, again, our men are raised to be strong, no weakness, be the hero, don't cry, don't show weakness. Um, Boys will be boys, basically. And when boys are being raised and they're taught that mentality, then the behavior just goes with them throughout the whole life. They don't They don't want to show weakness. They don't want to say, hey, something's going on in my head. Something's wrong. I don't feel right. I'm depressed. I'm sad, what have you. Um, when in reality, men are not the problem for that. It is a societal problem. Um, it is in the healthcare world problem because, healthcare providers, I'm not saying all healthcare providers, and I don't know the statistics on healthcare providers that overlook men's mental health. They may come into the clinic and they may say, hey, I'm sleeping too much, or I'm not sleeping enough, or, whatever. And we pass that off as, okay, well, you're just stressed. Like, buck up, man up. How many times have y'all heard that? How many times have my men that are listening, have you been told, just buck up, man up? That is absolutely the wrong thing that you can say to a man who is struggling, not just mentally, but physically also, emotionally. Um, you know, we'll have patients come into our clinic, male patients that'll come in, and they don't want to be open. It's not that they're trying to be dismissive of what they're feeling or what they're experiencing. It's just, one, they don't know how to express those emotions because, again, you've been taught your whole life basically and society has taught you to man up. Don't be weak. Don't show signs of weakness. You're supposed to be the strong one. So they don't know how to convey those emotions, verbally. The other thing is, we we want to tell people how they should behave. And as a society, yes, that is true to an extent. You have to have rules and whatever for the sake of society. But, you have a man that may go to work and then come into the clinic and he may say, I'm angry all the time. A year ago, I was not this person. A year ago, I experienced divorce. I had a job change. I lost my job. Whatever they may say, and things have snowballed for them, and they don't know how to effectively go, but I'm feeling like this every single day, or I've got this new emotion, or I'm sad, or I'm worried all the time. And, depression looks different in everybody. Mental health disorders look different for everybody. A majority of people are going to experience, especially our men, they're going to experience rage, anger outbursts, behavior changes. You used to have this quiet, meek, mild person who was jovial, laughing, whatever, cutting up. And now you have this introverted, don't want to go out and see friends, don't, just want to stay at home. And even though you may ask them, if this is your significant other and you've experienced this with your significant other, I would love to hear from you. But you may ask them, hey, there's something wrong. What's up? And we are all guilty of when a man will go, oh, nothing's wrong, I'm just stressed, work has just got me stressed out. We drop it. We drop it and we don't bring it back up because, one, men don't want to talk about it. So you don't want to bring it back up and like rehash anything. However, us as women, us as partners, your significant other should be attuned to who you are and how you are. They are your biggest advocate. Go be an advocate for your significant other. You are who that person has. And it is so important that we start recognizing in our men that something is wrong. That they're more reserved, that they're angry, they're sleeping all the time, they're not sleeping enough, their behavior is different. They either go out and drink all the time or, they find something else that they start using, substance abuse like marijuana or whatever the substance abuse may be. Recently, we've experienced something kind of personal. And this man has changed, and he goes out and he wants to party or be around individuals and is drinking a lot, and that's not normal for him. But instead of addressing the situation and taking care of it, now he's just gone out of the picture, and it's a tragedy. It feels like a loss for everybody, that he is no longer around after being here for 20 years. Um, and you have to wonder, when you start seeing that, like, when is the ball going to drop? It is estimated in recent data, showing that greater than 50% of the men who are committing suicide today sought mental health care in the last 12 months. And that says a lot for the healthcare world. That reflects more on what are we doing as providers? What are we missing? What is the healthcare world missing in these men? If greater than 50%, let's say it's 60, 75% of men went to a healthcare provider in the prior 12 months before they committed suicide, what are we missing? And we'll talk more about that kind of in another episode, but today I just kind of wanted to open up the episode to this is what the next 3 to 5 episodes are going to be about. I want you to reach out to me and give me your story. You can stay anonymous. um, how do we unlearn the behavior that men are taught? How do you as a man unlearn the behavior that you're supposed to be the strong-willed, can't cry, can't whatever? And I'll tell you, there's nothing like finding your person. Whether that's a friend, a cousin, a brother, your wife, your significant other, whatever. Find that person, and you can be a confidant to another person. Even if you are going through, if you have accepted mental health care, you are getting treatment. You are someone who can be a confidant for somebody else. Another man, your brother, a brother, whatever. You can reach out to people. You will notice the struggling signs of people around you, the men around you, even the women around you, and you can go, hey, there's nothing wrong with going and getting help. I did it. This is what I was experiencing, and this is now how I feel. And talk about, all the positives and the negatives of getting the help. If you have to start a medication, did you have side effects? Was it effective? Did we have to change it? Did they have to increase the dosage? That kind of things. Be an open book for people. But we as a society need to stop expecting men to stay strong 24/7. Men are struggling, men are burnt out, men are fatigued, they are lost, in themselves because there's pride there. We all have pride, but there's a sense of your manhood that's going to be taken away if you admit something is wrong with you mentally. Mental health in itself has a stigma, carries a stigma in this society, most societies anyway, but especially in America. Um, we don't address it enough. You're expected to get up and go to work still. Your bosses don't care. Your coworkers may not care. And it's sad. And you may come across healthcare providers that care. Obviously, there have been some issues in the healthcare world because, like I said, at least 50% of the men that have committed suicide had sought mental health care in the past year. Um, but we need to, normalize conversations. It's okay for you to have that conversation with people. Again, find your person, tell them something's wrong with me mentally. I don't feel right. I don't have good thoughts in my head. Um, and you can just tell one person. You could tell 1 or 10 people. It's totally up to you. If you don't want to tell anybody, find a therapist. We'll talk more about some, in a next episode, we'll talk more about how you can seek therapy, maybe even online, and it be very quiet, or it's not anybody's business. You don't have to share that with anybody if you don't want to. There are avenues for that. But I'm going to give you some ways, modalities in which you can seek that if you don't want to talk to somebody that you know, or go in person and talk to a therapist. Of course, men, listen, I've said this before in other episodes, you are ultimately responsible for yourself. Yes, more people we can recognize it more. We can educate, healthcare providers need to be educated more on recognition of mental health in men. But you are ultimately responsible for going, hey, something's wrong. And I will tell you, and I've told a male patient this, that I started medication on because he is having moderate depression. And he has been struggling for greater than 2 years, but it has gotten so bad in the past year that he did not even want to get up to go to work anymore. And he had to because he has a family to take care of. And we all know that you can't hardly survive in this economy on one income. But he was struggling significantly. Um, no suicidal ideations, but the thoughts of I would be better off dead. People around me would be better off. They would not be burdened by me if I were dead. And so we started some medication on him. And, you know, I tell people when I start them on something or we talk about it, I almost feel like it's not normal if you're not medicated in this day and time. Again, I'll go back to the pandemic. A lot of people were shut in. Mental health took a hit. We didn't know what to do with that. In our generations, we've never experienced anything like that. Um, so I just feel like if you're not medicated or you're not seeking some kind of mental health, whether that's, cognitive behavior therapy at home, you're reading, you're looking at books, you're, listening to music, you're walking, whatever that is, you don't have to have medicine. But I feel like if somebody is not seeking mental health, should they be? And you should automatically screen those people. That's just I think everybody needs to be screened for depression. Um, but, and this also goes out to the healthcare providers. It is so important for us to recognize and to screen. Again, we should be screening everybody. I think for the majority part of it, most everybody is getting screened because that's part of the value-based policy, how, part of the measures that we have to go by, quality measures. But what are you doing with those? Like, are you using the appropriate screening tools? But what are you doing with it? Are you treating these patients after you see a positive screening tool? What are you doing? Are you trying to push it off on to somebody else because you don't know what to do with it? Which is fine if you don't know what to do with it, and it doesn't sound like it's a typical depression, whatever. Then yes, by all means, boot it and send it to psych. But until that person can get into psych, because let's face it, mental health access in this country sucks. And a lot of the treatment for mental health falls back on primary care providers, which I am, a primary care provider. Um, so we'll talk more. I just wanted to reach out today to say that, man, you are not a burden. Um, we are losing a man every 20 minutes in the United States to suicide on average. That's what the rate is showing. Um, Mental health is no different than you seeking help for your high blood pressure or diabetes or, your erectile dysfunction. Because we've talked a lot about testosterone. But it's no different. Like you have to treat the brain just like you would treat the heart, the kidneys, the lungs, everything, because your brain is important. And so, in the next couple of episodes, we're going to kind of discuss, what exactly does depression look like? And does it look different in men versus women? And what are some ways that you can get help? And what are we going to do different in this country to help offset the danger? I mean, it's literally a scary, dangerous level at this point that, it's just hit me in my gut when I heard of the second suicide near in the same area almost. Um, and it's just a tragedy, and I don't know, I mean, it's kind of hard to talk about because suicide impacts people in such a way that you can't even comprehend, At any rate, um, we'll talk more about it. I just really want you to know that I'm here to listen. Please reach out to me by email. My email is listed below. Leave comments. If you've experienced suicide, someone close to you has committed suicide, or you yourself have had suicidal ideations, or you've experienced severe depression, or, whatever, and you've overcome that, then I would love to hear how you did that. You could be an inspiration to somebody that's reading your comment or that when I share, your story, it could really impact the next person. We often forget everybody needs somebody. And although some of us are more loners than others, and some of us are more introverted than others, we're not meant to be alone all day, every single day. We're supposed to help people. We're supposed to be there for people. And I just hope that, again, by the time we get through the series, that I've impacted at least one person to get the help that they need. You deserve it. You're not a burden. All the things, and if I can help in any way, please let me know. I just want you to know that mental health, we're going to kind of unmask that. We're going to keep unmasking it until my gut sets right. That's just how I function. So if you have any suggestions or comments or, worries or concerns or whatever, please reach out. And thank you for listening to another episode. And thank you for joining on this very important episode for, this topic. And then after this, we won't have to. I know mental health is such a stigma and it can be hard to listen to. It's so important though, guys. It's just so important. If you're not going to take care of your mental health, nobody else is going to do it for you. So just hang in there. Let's get through the next 3 to 4 episodes. Maybe you can help an individual, and that is our goal here. Let's bring light to men's mental health, and let's hopefully save, more men from suicide. I'll be releasing another episode next week, and until then, stay bold, stay healthy, and unmask anything. Okay? Thank you.